Eileen Veilleux The Fam here, and welcome to part 3, episode 3, in major depressive disorder in our mini mental health series. And in this video, we are going to cover the alternative formats for therapy, hospital residential treatment, and other treatment options along with lifestyle and home remedies. So let's get started. Formats for depression therapy as an alternative to face-to-face office sessions are available and may be effective options for some people. Therapy can be provided, for example, as a computer program, by online sessions, or using videos or workbooks. Programs can be guided by a therapist or be partially or totally independent. Before you choose one of these options, though, make sure you discuss these different formats with your therapist to determine if they can be helpful to you. Also, remember to ask your therapist if he or she can recommend a trusted source or program, because not all programs are covered by your insurance, and not all developers or online therapists have the proper credentials for training. So you have to make sure, don't just go online and do a training without checking with your doctor, because they may not have the proper training, and without the proper training, that could be detrimental to you. That's why my videos, I do not claim to be a doctor or anything. I just educate you on major depressive disorder, and if anybody thinks they have any of these symptoms, I do recommend that you go and seek professional help. Smartphones and tablets that offer mobile health apps such as support and general education about depression are not a substitute for seeing your doctor or therapist, and I agree with that 100%. Do not take any of these mini-series that I do as a substitute for getting the proper care. All these is what it says, educating. That's all it is. It's education on it. The doctors are the ones that know all the symptoms, and they can prescribe the proper medication. So please do not try to substitute anything instead of seeing your doctor. If you feel you think you may have major depressive disorder or any of the other disorders that I've mentioned before, please go see your doctor, your regular doctor or your mental health doctor, but get the proper treatment for it. Some other treatment options that are available are called brain stimulation therapies, and these are some of the ones that may be suggested. ECT, which is electroconvulsive therapy, which is electrical currents that are passed through the brain to impact the function and effect of neurotransmitters in your brain to relieve depression. ECT is usually used for people who do not get better with medications, or can't take antidepressants for health reasons, or are at high risk of suicide. So these aren't for everyone. They're very, these other treatments, they're very specific for different things. Another one is transcranial magnetic stimulation, or better known as TMS. TMS may be an option for those who haven't responded to any antidepressant. During TMS, a treatment coil placed against your scalp sends brief magnetic pulses to stimulate nerve cells in your brain that are involved in mood regulation and depression. And those are the two that are other options that may be available, but as it says, they're for people that do not respond to antidepressants or cannot take antidepressants for some reason. So the next thing we're going to cover is lifestyle and home remedies. Depression generally isn't a disorder that you can treat on your own. But in addition to professional treatment, these self-care steps can help. So remember, this is not something you can do on your own if you have major depressive disorder, but you can use them in conjunction with your medication. And these are: stick to your treatment plan. Don't skip psychotherapy sessions or appointments. Even if you're feeling well, don't skip any medications. If you stop, depression symptoms may come back, and you could also experience withdrawal-like symptoms. Recognize that it will take time to feel better. Learn about depression. Education about your condition can empower you to motivate you to stick to your treatment plan. Encourage your family to learn about depression to help them understand and support you. And that's exactly what this is for, is to educate you, your family, your friends, so they can understand and learn to see you from their heart and not their eyes, because the only type of help people can give is a good understanding, and you can't understand something if you don't know anything about it. Pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your depression symptoms. Then make a plan so that you know what to do if symptoms get worse. Contact your doctor or therapist if you notice any change in symptoms or how you feel. Ask relatives or friends to help watch for these warning signs. And these are all very important that you need to um, to put in with the person's treatment. If you have a friend that has major depressive disorder, knowing this can help them out. And that's what we want to do. We want to help them out, because major depressive disorder, if somebody has it, they're on the urge of suicide. And if we can stop that, that's a good thing. Okay? Avoid alcohol and recreational drugs. It may seem like alcohol or drugs lessen depression symptoms, but in the long run, they generally worsen symptoms and make depression harder to treat. Talk to your doctor or therapist if you need help with alcohol or substance abuse. Basically, what they're saying, yes, depending on the person, do not get self-medicate, is basically what it's saying, because you're only going to make it worse when you self-medicate. If a doctor says, like, medical marijuana would help you, then fine, do that. I know CBD is legal, and that does help relax you. Do CBD. But don't try to self-medicate with alcohol, because you're just going to cause your body more problems. All the alcohol or the drug use is a Band-Aid for it. And it's like putting a Band-Aid on a laceration. It's not going to work. And you're going to end up with more problems. Just for instance, alcohol will lead to cirrhosis of the liver, then liver cancer, and it will go into stages, and it will ultimately kill you. A lot of drugs have bad side effects that do things to your body. So, never self-medicate like that because you're only going to do more damage than good. Take care of yourself. Eat healthy, be physically active, and get plenty of sleep. Consider walking, jogging, swimming, gardening, or another activity that you enjoy. Sleeping well is important for both your physical and mental well being. If you're having trouble sleeping, talk to your doctor about what you can do. Some people are insomniacs. So if you're an insomniac, which is a person that cannot sleep, always talk to your doctor. Tell them everything that's going on with you so they can understand better. If you do not inform your doctors about everything that you're going through, they cannot help you the proper way. Okay, so always tell your doctor everything. Now, some of the alternative medicines. Alternative medicines is the use of non-conventional approach. Hold on a minute. Instead of conventional medications. Complementary medicine is a non-conventional approach used along with conventional medicine, sometimes called I can't even say this word. Integrative medicine. There we go. Make sure you understand all the risks as well as possible benefits if you pursue alternative or complementary therapy. Don't replace conventional medical treatment or psychotherapy with alternative medicines. When it comes to depression, alternative treatments aren't a substitute for medical care. And that's very important to know. Never substitute anything with proper medical care. Okay? Use these other things that you can, discuss with your doctor as maybe a secondary to your medication. Examples of, next thing we're going to go over is the supplement. Examples of supplements that are sometimes used for depressions are St. John's wort, although